We have Dr. Eseli Simiyu and our doctor also Boni Khalwale, who are our regular panelists. Also, they're medics in that particular front, so they come in handy for this particular discussion today as well. And of course, we continue also to give you these updates as far as the ticker is concerned there, just to prime you on the numbers and the figures, the way they're rising in the world so far. From Nigeria, we've heard also from the news, one person has died. This also just is a waking, of course, call to everyone that this thing is in Africa and people are dying. Right, let's just get to a panelist. We had from Dr. Eseli at the top of the hour, if you joined us then, and now we have Dr. Boni Khalwale with us as well, just to give us his feeling, a sense of what is happening on the ground as far as his observation is concerned. Let's begin with Western and the funerals as well, because you have at least a good grip on what really happens when it comes to funeral. Are people taking seriously the measures that were put forth even by Governor Oparanya in Kakamega? Boni Khalwale.
It doesn't look good.
It doesn't look good?
It doesn't look good because we have had to take a serious initiative to talk to it. Mm-hmm. Yeah, I remember in my neighborhood there were 2 funerals, mm-hmm. and 2 different things happened.
Yes.
One in Shinyalu, another one in Ikolomani. The one in Ikolomani, I went there and attempted to disperse them by way of what I was telling them. And the pastor who was saying mass, it was on Saturday, mm-hmm. then rose to kind of counter what I was saying and told people that they would have to be in charge the following day, which was very unfortunate. But the extreme was in Shinyalu, again in the neighborhood, which was a good thing and also a bad thing, to the extent that the mother of an MCA was dead and the MCA defied. So the police came from Kakamega, they tear-gassed everybody, and the police actually buried the mother of the MCA themselves. Mm-hmm. Where we have been very successful is one area we normally have very huge crowds.
Yes.
Is bullfighting. Mm-hmm. But I held a big meeting in Malinya, and I talked to them, and it has completely stopped. Mm-hmm. We've also stopped all harambes. It is working. If you go in Kakamega town, the major supermarkets, mm-hmm. they are doing washing of hands and so on before people go in. So at that level is good news. Mm-hmm. So what I would say is that we need to use the provincial, the former provincial administration, mm-hmm. to play it hard on people at funerals.
Yes.
Yeah.
Mm-hmm.
Yeah.
All right. So let's just also buckle down to the way Africa is responding, because we can see, as we mentioned yesterday, that the numbers are inching up. Rwanda right now, it stands at 19. That is from 17. So 2 more cases on that list. And we can see them, they have taken it very seriously as it stands. They're on a lockdown as we speak right now. We were at 8, that doubled over the weekend, and we saw that number has risen now to currently 16. And given that we have these cases from Italy as well, we do not know, the ramifications of this, right? Until we get information from the contact tracing, that is contact tracing that will come from the government, then we'll know if the numbers will be piling up. Are we foreseeing, because I can see South Africa has taken the case as well, because now it has the highest caseload as it is right now. Are we likely as a country to face the reality of a lockdown? And if we are we prepared? Dr. Eseli.
It's not a question of being prepared. It's a question of what is right. We have no choice. That one I've kept on saying. We have no choice. We have to lock down.
We have to lock down?
We have to. We must. Reason? Because we are a poor country. When you're a poor country, even the contact tracing you're talking about is not as efficient as it's supposed to be. You cannot quite trace these people. Secondly, because we are poor, mm-hmm. that's why we need to lock down. I know people are saying that they live hand to mouth, so they have to go and do their trade to be able to eat. We have what we call the strategic food reserve, which has got grains, maize, beans, rice. I'm sure if we locked down and these people stayed in their informal settlements without moving around, and we delivered the food there and gave it in an orderly manner, and lockdown is not a joke. if you see what South Africa has done, the military comes out. So first we should equip the military with protective gear. They come out. So the distribution of food is done by them. We have no choice. And this one, I remember when Mutahi Kagwe appeared before our committee earlier on, before Parliament adjourned.
Yes.
I told him that where we are, we need to start locking down. And I'm happy that a few days later, they actually closed schools. That was a very important thing to do. But you see, what we have failed to realize as Kenyans is this. The world has become a global village. So pandemics are going to occur now and again. It's not like the time of SARS when movement was not so, but right now you can see a priest flies in from Italy,
yes,
has gone to South Africa, comes to Kenya, is all over before he flies out again. So it has become a global village. So pandemics will occur. In the developed countries who are better equipped than us, they are having difficulties handling this. And because they delayed a little bit. If we continue delaying, I'm afraid what we are going to come up with is a disaster. So I would suggest this, that whatever the government is doing, they should be seriously, in the next 12 hours, be planning how they manage lockdown and proceed quickly to lockdown. That way, we'll be able to save lives. Remember, we have got a very huge susceptible pool. Just as the South African president said, or Museveni said in Uganda, we've got people who have been affected by HIV, their immunity is low. We've got the elderly, their immunity is low. We've recently been talking about the cancer scourge. These people with cancer, their immunity is also low. So we have a very huge susceptible pool of people who can succumb to this virus.
That was Ramaphosa in South Africa saying.
Yes, Ramaphosa, yeah. So we need actually to take those drastic actions. This is no time to sugarcoat anything or babysit anybody, because it's about, okay, we say that people economically will suffer. I would rather they suffer economically now and stay alive to rebuild the economy, rather than we suffer economically and we lose so many people so that rebuilding the economy will be difficult. I think these are difficult times. They require very drastic measures. And Minister Mutahi Kagwe, whom I respect, in fact, when I see him talking and his actions, they remind me of the determined first Kibaki cabinet, which he belonged to. So he gives me a lot of confidence. In fact, my heart goes out to him because he has taken over a ministry that had been ravaged and savaged by all sorts of people, playing musical chairs with all the professionals who were in the ministry, throwing this one there, throwing that one there, such that by the time he's taking over, he has an acting Director General of Health. When a ministry should be better staffed than what we have. So Mutahi Kagwe has taken over a ministry that had been ravaged seriously by mismanagement, and yet he's faced with this problem. I hope people are listening to him, because I believe in his heart he knows lockdown is inevitable. I hope the rest of the government system is listening to him, because apart from these issues that I've said, that we have a very huge susceptible pool of people who can succumb to coronavirus. Remember, the health system itself. We've downgraded our health system. We've denigrated the health personnel. The health workers have been made to feel like they're useless. And right now, those are the same people we need to rely on. So many of them are unemployed, yet we need them. So we are at a very difficult time. So even if we talk of not locking down, do we have the facilities to take care of those that will fall sick? Because if you look at the private hospitals, those are just merchants looking for money. They're not serious. Most of them, if you go to a private hospital, it's just a huge bill you come out with. You don't come out with a huge treatment or whatever. Most of these private hospitals, I'm not saying all, but most, are just money-minting enterprises. So we are actually in dire straits. So what they have done, getting some hotels to do isolation, that is good. But they should just look at the hotel industry seriously, identify serious isolation points, and generally proceed to lockdown. There is no time to waste, because if we waste more time, then we'll have a problem that we'll never be able to surmount. Remember, I said this earlier, that our health system, we've never dealt with such an issue. Uganda has dealt with Ebola, so they have a number of trained people. Kenya has those people whom we send out to help in the Ebola areas.
The Ebola team.
But they are very few. They are very few. So they can be used as resource people to train others to go out there. But the few that we will train we'll need to use them effectively. And the only way we'll use them effectively is to lock down now. If anybody in the government is listening, I think in the next 24 hours, they should make that decision. Because you see the numbers are going up. You see what you are telling us about what happened in Shire, what happened in Kilifi, and all that. Now, if 1 or 2 people were infected there, how many people have they infected already? So it's important. In the villages, it might be easier to control this, because I've seen in my own home, unlike what Khalwale is saying, I've seen now funerals being attended by 20 people, 30 people, which I think I would like to thank the chiefs and the assistant chiefs who have actually done this. In fact, one of the assistant chiefs had lost his own relative, and there were very few people at the funeral. I think I commend them. But after commending them, we need to understand that this is for our own good. It is not that the government is being merciless. It's not that we are being unfair. No, this is for our own good. And as we lock down, yes, I would advise people to avoid going to see their old parents. Because if you, for heaven's sake, you are carrying it, you have killed them because of their age. So lockdown is a serious thing, and we need in the next, in my estimation, in the next 24 hours.
In the next 24 hours?
Yeah, because when I trace through these people who have been identified as having had the virus, and they gallivanted all over the country. Remember, now we are talking of from coast to coast, from Kilifi to Siaya, because Siaya is on the coast of Lake Victoria. So that's from coast to coast. There is some element of somebody who has been around who might have infected people. So this is not a time to joke. This is not a time to play politics and try to look good and try to, carry favor with the masses because of the votes and so on. No. As leaders, this is the time to put our foot down. I was home over the weekend. Usually I meet my people on Saturdays. They come to see me with various problems. I didn't. And I told them, you'll have to forgive me. Some of them left cursing me. But I thought it was for their own good, because they come in large numbers. So from morning, very early in the morning, they were being told, no, no, no. So sometimes as leaders, we need to take the hard decisions. They might make us unpopular, but in future, the people will look back and say that if we didn't do that, they would not have survived.
They would not have survived.
Instead of playing with weak responses that will eventually endanger our people. And then once we pull out of this, because eventually we will pull out of it, we need to relook at our laws on medical laws.
Right.
The idea of devolution, how should we structure the devolution of health?
Right, thank you.
Otherwise, without that, I'm afraid we are heading to trouble.
Right.